speak to us about this testing that is going to be rolled out, that the Minister is profiling today.
Certainly, Kathy, after the announcement by the President to ramp up the efforts in reducing, well, rather testing and finding the people who are infected by the coronavirus, these units have been launched today. As you can see, the Minister, Zweli Mkhize, and the Gauteng MEC for Health, they're coming out of one of these units. Now, there are about 60 of these units that have been procured to be sent throughout the country to ensure that districts and various municipalities have these so that they can have more mobile testing, so that they can trace the infected people, and those people can then be given the opportunity to be tested. These are for screening rather, and then those people will be tested and then determined whether they will be isolated in their homes or they will be sent to hospitals depending on the validity or the heaviness of the infections. As you can see, Dr. Zweli Mkhize is also will just take you there. There are some other equipments that are here as well, and he's really just going through the amount of things that will be distributed to communities. These are various equipments and various technologies that will be used to ramp up the efforts to test and then make sure that the people that are found to be infected are treated in the best way possible.
All right, Hitekani, I'm going to ask you to stay with that picture then as the two officials go through some of this equipment. Now, what we've been told is that there will be at least a 10,000 strong force of medical officials and personnel and researchers who will be tasked with the duty of going into different communities and conducting then these home testing, this home testing that is going to be done. Do we have yet the details in terms of how it will happen? So especially for people at home who are thinking, when can we expect people to come? What will they come looking like? Also bearing in mind the risk factors that are associated.
Absolutely. The risk factors have to be considered, considering that there are criminals that might try and take advantage of this situation, going to people's homes and masquerading as officials from the health department. So those are some of the issues that we are going to certainly quiz the health department about, because they're quite essential. And the details about the rollout aren't clear as yet, and that's why we assume that the minister is going to be giving his briefing in the next couple of minutes. Certainly quite a number of unanswered questions, but we do know this seems to be a second phase in the fight to reduce that high number. We know that we've reached the 1,000 mark already, so it seems to be the next phase in fighting aggressively against this breach into the thousands of infected people. So the details of how this is going to be rolling out we'll hear in a couple of minutes, but these are just the units that are launched today, and as I said, there are about 60, and as you rightly said, about 10,000 field workers will be rolled out and sent out into communities throughout the country.
All right,